Many elderly people struggle financially with the cost of necessities, whether it's food, housing, or health care. For the past few years, ABCD has been trying to help elders stretch their food dollars in a way that's more healthy. To bring us up to date on the Food Dollars program is our guest from ABCD, the Director of Elder Services, Nicci Meadow. Thank you very much for being with us, Nicci.
Thanks for having me.
So why did ABCD start up this program?
Well, we found that lots of older adults don't have enough money or access to healthy, nutritious food. And we thought there was a need to teach good nutrition, healthy nutrition, and acknowledge that people live on a budget, and we needed to help them stretch their dollars. There are lots of programs out there that just teach nutrition, but they teach it in a way that assumes everyone can go out and eat healthy fruit and buy all the vegetables they need.
Because one of the other things you might have to do here is get people to think differently about what they need to eat.
Yes, we teach what healthy nutrition is, and we talk a lot about eating whole grains, eating fresh fruits and vegetables or frozen fruits and vegetables, and really cutting back on the not nutritious foods, the fats that aren't good for you, and to watch the salt intake. And we really teach people what healthy, nutritious food is all about, and that they can have healthy, nutritious food while stretching their food dollars.
Well, I'm approaching your age group here, at least the people you're serving, and I grew up, healthy food was meat and potatoes, so I know that, yes, it's healthy, but how do you look at that in a different way when you get older?
Well, we do suggest that people eat more fruits and vegetables, and that they look at their portion sizes as well, so that you can still have that steak and potato. We don't tell people to cut back. We're not a weight loss program. But to look at the size and the portion of that steak so that it's the size of your palm. We do suggest, instead of the potato, eating maybe a whole grain, such as a whole wheat bread or like a whole wheat cereal, so that they're eating more whole grains.
Now, of course, sometimes if you're looking for whole grain bread, and sometimes there's a difference between whole grain and whole wheat, so you might find that, well, if you want the whole grain, it's going to cost more than your average white bread.
Right. Whole wheat bread might cost more. We do suggest that people keep it in the refrigerator or freeze half the loaf. If you're only cooking for one person, you might want to freeze half and take it out for a later time, because there are ways to eat healthy on a budget if you do put your foods in the refrigerator or in the freezer and have them for later.
Speaking of proteins, it's not just from meat. Talk about some of the other places that you can get it from that might be
more.
Yeah,
there are definitely beans is another source of protein that's not as expensive. You can buy your beans in cans. What we teach people to do is to rinse the canned food. We try to get people to use more frozen vegetables because they don't have as much sodium, but if you're going to use the beans in the can, and that's pretty much how they come, we suggest people rinse them, and that's a great source of protein. We also talk about tofu. That's something people haven't tried before that they might want to try, but we do suggest people eat the beans as well to save on the cost of meats.
I've heard mixed messages about eggs. What about that?
We don't say anything that you can't have or you can have. If somebody wants that sundae, they eat that ice cream sundae once every 2 weeks, we suggest that they have it. If you want to have an egg can be more nutritious than a bowl of cereal. And so we don't say there's anything you can't eat. We suggest people talk to their doctor about what kind of health conditions they may have. And in fact, what we know is that people who are at risk for hunger are in poorer health, and there are so many diseases that can be improved, like heart disease, diabetes, high blood pressure, kidney disease, and cancer. With a better, more nutritious diet, they can really improve their conditions.
As you said, this is a program for people age 50 and over, so you might have some people who are not retired yet, but maybe their income has been scaled down, and I guess that brings up the question of benefits.
Yes, we do encourage people to apply for SNAP as part of our Food Dollars program, which, by the way, is funded by the AARP Foundation. We do encourage people to apply for SNAP, and they can get as little as $16 a month and then save that up for 3 or 4 months and then be able to do a sizable shot. But people, when they apply for SNAP, if they list their medical expenses, and this is not known and we want this to really be understood, if they list all their out-of-pocket and their medical expenses, hearing aids, co-pays, anything like that, vitamins even, and if they can claim more than $35 and 1 penny over will really increase someone's SNAP benefits. And only 1/3 of those older adults who are eligible actually get SNAP. And if they apply for food stamps or SNAP, which is the new name for it, they can really find a way to stretch their food dollar.
And I guess the other thing is, especially the sooner you have to get these benefits, is that if you lock them in early, that helps you later on because your expenses might go up. You might have to start taking another medication, or your heating bills will go up.
Right. The more benefits you can get, the better. We tell people about how to reduce their health insurance costs by calling the SHINE program. We teach people about what's called $2 a bag, which is run by Fair Foods. And that's a full grocery bag of fresh produce and fresh vegetables that they can get for a $2 donation, but they don't turn anyone away. And as your circumstances change, you can always apply for SNAP. You can always say, okay, I've lost another source of income, and get more food stamp benefits depending on your income. So you do want to try to get as many resources as you can to stretch your food dollar.
Well, a lot of us non-retirees can get in a car and go to a big supermarket and buy produce there. But for elderly people, they don't have as many options. A lot of the times, I guess the places where you can buy fresh fruit and vegetables, they might be in a small store. The prices might be really high. What's the best way for them to get out of that?
Well, we found that people do shop both at the grocery store and the small bodegas. And again, some of the small bodegas, the small stores in the neighborhoods don't have as much access to fresh fruits or vegetables. There are a lot of in the elder housing buildings transportation, a van that will take them once a week, or family members shop. So what we suggest is buying frozen if you can, so that you can take out a portion size that you need, and it's just as good as fresh vegetables. So there's ways to still eat healthy on a budget, even if you can't get out to the big supermarket every week.
What about salt and sugar? Now, I know people, they're not literally taking spoonfuls of sugar, but there are a lot of things out there that have sugar in them that you have to be careful of.
We do suggest, again, that people watch their sodium intake, because it's a very serious condition for many older adults who can't have the sodium. And so we do suggest, if you're buying a can, that you rinse the can and get most of the sodium out of it, or that you buy the fresh or the frozen vegetable. So we have found that people, after taking food dollars, have reduced their salt intake quite a bit, and have also reduced their sweets and their candies and their pastries, and have increased their fresh fruits and fresh vegetables as well as frozen.
I want to ask you about an attitude problem, because I imagine a lot of the people you're trying to help grew up feeling that it was just a shame if you had to take food stamps or welfare. Do you have to work around that somehow?
There is a pride issue for some people, but what we try to do in the class is basically tell people that you're not taking away from anyone else. You've worked, you've fallen on hard times, or your monthly check is not enough. There's more month than money, and there's not shame involved. You're not taking it away from anyone else, and it can really help make a difference in your health. People who are hungry have poorer health outcomes. They stay in the hospital longer, they have more disability, and they don't fight infection as well. And SNAP benefits can really help an older adult get past that pride, because everyone wants to be healthy, and when people find out their health is at risk, if they don't apply for SNAP benefits, we're hoping that people will really apply or use these other resources or benefits, such as the $2 a bag program, to get more fresh fruits and vegetables into their diets.
If people would like to find out more about this, what's the best way?
The best way is to call ABCD, and you can call 617-348-6000 and ask for the Food Dollars program, or ask for the neighborhood service center that ABCD runs near you, and we can help you apply for SNAP or tell you when the next Food Dollars class is going to be in your neighborhood.
Thank you very much for being with us.
Thank you.
Nicci Meadow from ABCD.